There are 4 parts to labor. Some people call them stages, some people call them phases, but knowing this gives you like a blueprint to what your labor is going to look like. So I'm excited that you guys are here to learn this information because a lot of these can seem scary if you don't know that they're coming up. And while we're here, I have a signs of labor checklist that I'm going to link to down below. So if you're looking for the signs of labor, they'll be there for you. Now, in my 20 years of labor and delivery, I would have patients who were like, what phase do you think I'm in? And I was always like, it's not something that we chart. It's more a blueprint for you to know how things are going. Because me, as a labor and delivery nurse, the more patients I see, I obviously see these different phases going on. And so it's exciting to give you guys that information so you can know a little bit more what to expect. Now, this is just the very basics of labor. If you guys want to learn more about labor, I 100% recommend taking a birth class. I'm going to put the one that I recommend down below. And again, some people call these stages, some people call them phases, and then some people break each of these ones down into different stages or phases. I don't really know, but these are the basics from a professional. Okay, the first one is latent labor. And this is early labor is another name for it. And, the numbers for these fluctuate quite a bit. And it really is kind of depending on how you're acting and what your uterus and your cervix are doing to show that you're moving from phase to phase. When I started labor and delivery, this was 0 to about 4 centimeters. But lately, they've taken it up to 6 centimeters, so 0 to 6 centimeters, if you're in labor. Obviously, if your cervix is closed and you're not in labor, then you haven't started any of these stages or phases of labor. But once you've started into a decent pattern, that is when you would start into this. Now, latent labor can be prodromal labor, or early labor can end up being prodromal labor, where it happens like every night. Now, if you're looking for videos on that, I have some because it is a lot of emotional toll on the body. I'm going to link that up above and down below for you guys. This is the part where your uterus is just doing, in general, smaller, lighter contractions that are preparing that cervix or ripening it. By the way, if you have no idea what that is, I have a video on ripening your cervix I'll link to down below as well. But usually you're not rip-roaring for these first few centimeters. A lot of people will be in the office and ask for a cervical exam and find out they're 2 centimeters and think, oh my gosh, I'm in labor. But in reality, your uterus has been doing these tiny contractions to get your cervix, which remember is just the bottom of the uterus, softened and prepared for labor. That doesn't mean that you're in labor, it just means the uterus is doing those. And a lot of times those early, some people call them Braxton Hicks or practice contractions, those turn into the bigger contractions that put you into more early labor. And yes, this is confusing. It is not a hard line. As a nurse, we were required to chart when a patient went into labor. And you'd have nurses like sitting at the computer who'd been doing it for 20 years. We don't know when you went into labor. It's not a hard line. For most of us, it was when you really started to hurt, asking for pain meds, really using your coping mechanisms. But who knows? Who knows when you went into labor? But the next one is active labor. And that is when this uterus is actively contracting and actively dilating your cervix. And that is the point at which we would love to see you at the hospital. Early labor is best managed at home. By the way, managing early labor at home can be a little bit scary. I recommend a birth class that goes over how to manage early labor at home effectively to both give you the nutrients and the rest that you need, but also keep labor going. Again, the birth class that I recommend does just that, and I'll link it down below. But as you move into active labor, where your cervix is actively dilating, meaning if I check you now, it's 5, and I check you an hour from now, it's like 6, or I've noticed change. That's when you want to head into the hospital. And of course, if you guys are interested in a video about when to go to the hospital, tell me down below and I can make that one for you. So active labor is when your cervix is just actively dilating. There you go. Now, there is a part of active labor called transition, and that is when your cervix is moving from about 9 to complete. And it is a time frame where your body is going to feel very overwhelmed. This is right when I hear people saying, I can't do this, I need the epidural, I can't do this, I need pain medication, which we can't really give you pain medication at 9 centimeters usually, sometimes if it's your first baby. But it is the part in which you start to doubt yourself. And knowing that doubting yourself is going to come when you hear yourself saying, I can't do that, you're going to tell yourself, I'm in transition. We're going to make it. We are going to do this. My body is telling me I can't because we're right at the end of this. So I think that's one of the most important things to know about the whole stages and phases of labor is it is very routine for moms right at the end to think I can't do this. I'm going to die because it's right at the end. It's that last mile of the marathon. And then crazy thing, When you get to the third stage of labor, which is pushing, it actually feels better because you're able to push against that pain rather than trying to relax into it, which is really hard. I got to tell you, when my appendix ruptured, I wasn't thinking, I need to relax into this pain. I was thinking something is really wrong. I need some serious drugs. And as I said, the third stage phase, whatever, of labor is pushing. Now, a lot of people think, oh, I'm complete, that cervix is totally gone. I'm just going to push a little bit and then this baby is going to come out. But fun fact, on your first baby, the average pushing time is about 2 hours. I know, you're all dying. I actually have a bunch of videos over here on pushing. I'm going to put the most popular ones down below, but if you want more education about pushing, definitely check out those videos. They can be super helpful. Now, the third stage of labor ends with the delivery of the baby. The baby comes out. And then we move on to the fourth stage of labor, which is waiting for the placenta to come out. Now, in case you didn't know, your placenta is attached to your adorable baby. So baby comes out. We do delayed cord clamping, and then they clamp the cord. Baby goes up on your chest, and then this placenta is still on your uterus for a little bit until the uterus does a contraction and it peels away from the uterus and comes out. Normally, this is the quickest stage of labor. It has the least to do with you. If you don't have an epidural, you are going to feel some cramping, and your provider may ask you to push. You may also feel a gush of blood, and it's often a sign for us that, oh, something's happening. So sometimes that takes a little bit longer. I think it's important for you guys to know that it can be problematic in some people, but for most people, it is not a big deal. If it is problematic, usually they give you drugs and they try and scoop it out. I'm not going to go further into that, but it can be a problem. And I think it's important for you guys to know that it can be. When it comes out, relief, that part's over with. Now, a lot of people are like, oh, then there's the fifth stage of labor, and that's postpartum. And I was like, great. So I'm still in the fifth stage of labor with my 16-year-old. I don't know, but I think having that roadmap will help you guys kind of know what to expect and know kind of why being in the hospital during active labor is best and why staying at home during early labor might be best for you as well. And it can be really emotional, like trying to decide if you're in labor or not in labor. I have a whole video on these roller coaster emotions surrounding labor that I'm going to link to up above. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.